You're welcome back. And I have with me today a pharmacist with years of experience. She's a health advocate, Farm Dorothy. Good to have you again.
Thank you so much for this. Good to be here again.
All right. When we say self-medication, what does it mean?
Just like the word implies, self-medication. So it's the use of medications to treat a self-diagnosed illness.
Okay.
So you take medication for something you diagnose yourself. So you have a headache. Oh, you think you have malaria. So you go and buy malaria medications. That's self-medication.
All right. So if I feel some headache and I walk into the pharmacy to buy any painkiller, I'm self-medicating.
Yes.
Is it advisable?
In the long term, no.
Okay.
But then, one thing about self-medication is that it provides temporary relief of an illness, especially if it's something which is very basic, like you said.
Okay.
If you have a headache and you start to take paracetamol, that's fine. But then in the long term, especially if the headache keeps on coming, like you take the paracetamol, it goes for a while, it comes back again. So it should tell you that it's not just a simple headache, it might be something else. But because you're self-medicating, you might not take it seriously. So in the long run, no.
All right. So before we look at the long run, if I should have some illness, I've seen a doctor, I've been prescribed a medication. And after some time, I feel I experience such or similar situation. Is it good for me to go to the pharmacy, keep the same, the old tablet and then go and then buy the same thing? Is it good to do that?
Well, it depends. It depends. This is why I'm saying that. If you go to the hospital, maybe you had typhoid. I'm saying typhoid because it's the most common thing people do nowadays. I don't know why in the pharmacy. So you had maybe headache, you had a running tummy, you were feeling nauseous. You went to the hospital and then the doctor said it was typhoid. And so they give you some drugs, you go home, you felt better. 3 months later, it happens again. Oh, it's the same way I felt when it was typhoid. So I'm going to buy the same medication. You might be wrong because those symptoms I'm talking about is very common for a lot of diseases. It might not be typhoid.
Okay.
But then there are certain cases where you've been diagnosed as an ulcer patient, for instance. So then whenever you have a flare, there are medications you take when you have a flare.
Okay.
So in that case, you can be like, okay, so when I have my flare, I take this medication. And in those instances, the doctor will tell you that when you have a flare or when there's a repeat of this symptom, take this.
All right.
So in those cases, you might not need to go back to the doctor. But then, in a nutshell, no. You can't go and keep a prescription and then go and buy it again because you had the same symptom. Unless the doctor has told you. And it will be written on the prescription if that's the case. The doctor will be like, repeat 3 cycles or repeat 4 cycles.
Okay.
Yes.
And then, so in this case, we're talking about adults. What about parents who have babies and they have special medicines that they buy for them? Sometimes they don't consult doctors before doing that. But in this case, what are the possible implications and how do we correct such mistakes?
Yes, so that is totally wrong, especially for a child. Now, a child's physiology, like the child's body, the way they react to stimuli and medications is very different from how an adult would react to medications. That's the first thing. So the fact that you use a cream for yourself or maybe for your 3-year-old doesn't mean you can use the same cream for your 1-month baby. So you cannot, especially for children, self-medicate. Whenever you have an issue, you need to seek professional advice. If not, it can cause death, it can cause allergic reactions, it can cause illness. Whatever case or problem you're trying to solve, it could actually become worse before you go to a doctor, and by that time it might be too late. So it is very important for you to seek professional help, especially when you're dealing with kids. You do not just buy things because your friends recommend it. Totally wrong. You are putting your child's life at risk when you do that. It's always always important to talk to a doctor or a pharmacist about any medication you buy for your children before you do that.
Yeah, there are some common medicine that parents go for when the child is feeling warm, and then also when they are growing their teeth and stuff. Usually they go for it because that is the common one they know.
They know, yes.
Now, my question is two aspects. Is it advisable that because it is generally known for that purpose, they should go for it, or they have to go and see the doctor for the doctor to assess the child and recommend?
Okay, so for temporary relief, like for short-term relief, if your child has a headache and you know that this medication solves headaches, or you can use paracetamol to treat a headache, yes, go for your paracetamol to treat a headache. However, should this headache persist after you are taking the paracetamol, you need to see a doctor.
Okay.
So it's a very thin line between when to go and then when to just wait and see. So it's always good to also seek professional help in those instances. So you give a medication to your child a day, 2 days. You see it's not really getting better. Why are you waiting for 3 or 4 more days?
Okay.